there's a lesson here for local businesses. And by the way, how is DPC playing in Lafayette? Is it gaining any traction?
Gaining a little bit of traction recently, after being open for 13, almost 14 months now. We are gaining some traction. Word of mouth is spreading, and people are having experiences. And then, I'm getting phone calls from folks based on those experiences. And so a lot of individuals coming in, but in fact, I have a small business with 13 employees, and they are in the middle of signing up this week. They're making changes with their insurance plan, and we're going to be saving that business. 13 employees. We're going to be saving them about 60% on what they're currently paying for a fully insured health plan.
60% savings.
Mm-hmm. Yep, they're changing everyone over to basically just a catastrophic plan that the company's going to pay for 100% now, and so the employee will have no contribution to that. And then our membership, which is also going to be 100% covered by the business now, and we're saving them about 60% of what they were paying a month ago. And the only thing the patients will have to pay for is medications and labs directly through our clinic, which are, pennies on the dollar.
That's compelling stuff. I mean, it really
Not
is.
to mention the access. So, we have a lot of oil field related businesses here in Lafayette. This is kind of the epicenter, or used to be the epicenter of oil production in the Gulf of Mexico. And so a lot of those people are now going off to, all parts of the world during their time where they're, working with these companies. And you can see it right there in the picture, but we have a map that we keep in the clinic, and I put little push pins in it from little places, any place outside of Lafayette or outside of the local area that someone has called us. And I've been able to talk with them. You mentioned coronavirus, and 2 days ago, we beat our record. Korea is about right there on the map, and we were able to talk to one of our patients who was in Korea working at a BP plant, and they had a coronavirus scare. And so I talked with him for 20 minutes about, what he should do to protect himself, and kind of reassuring him a little bit.
Yeah. I think I remember reading about Union County in North Carolina.
Mm-hmm.
The first year they implemented direct primary care, they saved $1.2 million. If a government can do that, hello, and government and a county government, state and local governments can't print money. This is hard dollars that they're saving. So it should be a lot easier for businesses to kind of get the memo, and they are. And I think it's, knowing what I know, it's a no-brainer. So I'm glad to hear that it's gaining traction out in Lafayette. But I think you can also make the case that you can make more money. And if I put on my CEO hat, I understand that I have a lot on my plate as a CEO. And healthcare is a pretty complex subject. So I have to balance my time, and generally a lot of CEOs and business owners will just farm it out. They call a benefits advisor and let me know how much the bottom line is, and we'll raise our costs accordingly, our prices accordingly to cover it. And so I think if you're a CEO, you ought to take the brakes of judgment off and sit down and pay attention to what this brings to the table. But CEOs also have to, they have a bottom line. I mean, they've got to pay attention to the bottom line. They've got other things on their plate. I got that. So it makes sense to sort of equate this to things that they would understand. Every business has a process or multiple processes, and they're deeply involved in those. And so one of the things that you mentioned is the faster access, even from Korea. Well, faster access equals less downtime for the employee. So productivity goes up, getting stuff done. And I'm wondering if you've got any examples of how that access for someone who calls you up in the morning and says, I got to go to work, but what do you have? What kind of examples do you have along that front?
Sure. I mean, I could go through a number of those things, but I've had patients call me on Saturday morning who are working on Saturday. They can't afford to be away from the office or away from their small businesses or whatever it is they do. The one example I'm thinking of is actually, a person who has a full-time job during the week, and then they kind of have a side gig that they do on the weekends. And they called me at like 7 o'clock in the morning on a Saturday morning, and really upset about symptoms, and basically viral illness that was treated with some steroids and some antihistamines. But they met me here, and I was able to examine them and reassure them that this is not Ebola or anything, and they get a steroid injection, and a couple hours later that starts working, and they start feeling a whole lot better, and they get on their medications and are able to be productive through their day. And so in theory, that person made a whole lot more money than they paid for the month of membership, just in that one day, because of the access at 7 o'clock in the morning, rather than having to wait all weekend or go to an ER or an urgent care where they may have to sit for hours. Another example is, a mom whose 15-year-old son fell off of his bike and had a laceration on his arm 7 o'clock in the evening. And rather than going to the ER and sitting in the ER for 3 or 4 hours, which would have kept her up all night and, made her less productive in the day the next day, they came and met me in the clinic, and I think they were probably out of here and home by before bedtime, I would say, 8 or 8:30, with, maybe they were perfect sutures. I don't know. I'll go ahead and say they were. And a bandaged up arm, and again, no extra expense. It was really quick, and they were super grateful for that. And mom gets a full night's sleep and has peace of mind, and is, her employer, whether they know it or not, is happier because they have a more productive employee the next day, because of that peace of mind and rapid access.
You just mentioned something about you're preventing problems, and the employers, and a lot of employers, if I'm a CEO, one of the things I do know is that the problem solvers, I know who they are. It's far more difficult to find the people that prevent problems in any organization, mm-hmm. for the simple reason the problems don't appear, and they don't need to be solved. So what you're sort of being the unsung hero, and businesses need to understand what that means. There's another thing that as a business owner, a CEO, or a manager, I want my people awake, aware, and alive at work. I want them focused, and I want them. I want mental clarity. I want them to have good judgmental powers too. And I'm thinking of one cause that lowers those things, and that's undiagnosed, untreated sleep apnea. Mm-hmm. So what are some of the other things that you can think of medically that are in the same realm? They're undiagnosed, untreated, but time with the patient to unpack the patient's history, the tests they've had, et cetera, and you can start to say, aha, now I know why you're feeling sleepy, or et cetera. What are some of the other things?
Yeah, I mean, again, long list of things, but just off the top of my head really quickly, vitamin levels and those things, hormone levels, hydration status, people's nutrition, pre-diabetes and diabetes that go undiagnosed for long periods of time, which then cause their own problems. I mean, the list goes on and on and on and on.
Sure. Yeah, I was thinking diabetes. Well, the more patient time you have, and the more flexibility you have with your time, you can make sure that things like flu shots get done in a timely manner. And less sick days, that's a measurable thing. As a CEO, I can measure that. And I like things that can be measured. And most CEOs and business owners are like that. You're a business owner, you understand that. Yep. Productivity goes up, but also what about my drivers? And accidents? What about my customer service people? Are they kind of like, when you went to your doctor's office and ring the bell and what do you want?
Yeah.
You don't want that.
Right.
And so there's some other things here that I'm thinking of. I know my employees are stressed out, and I know healthcare is a big part of that because it's the biggest issue in this year's election. It's right up there at the top. I think over 65% of people say that healthcare is probably their number one worry and what they're focused on. And it seems to me that there's a lot of FUD factor, fear, uncertainty, and doubt. And since you served in the military, you know exactly what I'm talking about. And so the care that you provide sort of reduces the FUD. They know they have access. They know they have time with you. They know they have someone who is capable of dealing things rapidly. And so you reduce that stress level. And from a management perspective, I'm all about that. I love that. And there are less suppressive influences for my employees, and that's a big one. And I want to lower that so they perform better and that they're able to make me more money. And one of the attributes of care that you sort of alluded to, and that is that people need a care quarterback, someone who's going to coordinate all that. In your corner care is one of the ways I describe it. And so maybe a couple of examples of how you provided that care coordination for whether it's an individual or an employee.
Well, you know, as you're talking about a care quarterback or care coordinator, that's one of the things that primary care doctors have been sort of pigeonholed as in the old system, or the system that, you know, most people are dealing with now. And the reason for it is that, again, when you go through all of those hoops that are required to get reimbursed for your time, you have very little time to deal with the patient. And so when someone comes in, you know, let's say I have someone who's in their mid-50s and they're overweight and they have high blood pressure and high cholesterol, and you know, let's say they have asthma and they've had it since they were children, and they've got diabetes or their, you know, metabolic syndrome or prediabetes, and they come into my office in the old system. I just didn't have time to go through all of those medications and all of the explanations about how those things are intertwined and can be improved by, you know, diet, exercise, weight loss, and all those things. And so it was just easier. And, you know, unfortunately, it was just the common thing. And it's probably the common thing for a lot of doctors now to say, you know, for your blood pressure issues, go and see a cardiologist, and for your lipid issues as well. And for your asthma issues, go see a pulmonologist. And for your diabetes, go see an endocrinologist. And oh, by the way, that sprained ankle that you have that's been hurting you for 2 weeks, go see an orthopedist or a sports medicine doc. And you go ahead and schedule those appointments and then come back and see me in 6 weeks and we'll talk about all those things. And so now that patient has spent 2 hours in my office, in my clinic at least, not in front of me, but they spent 2 hours in my clinic, so that I could send them off to 4 other doctors over the next 6 weeks so they could experience the same thing over and over and over again. Oh, by the way, paying copays or deductibles for those visits as well. And experiencing the same thing all 4 times. And then they've got a 5th visit coming back to me in 6 weeks. And with direct primary care, we just don't typically send patients to specialists unless we need procedures done. You know, if you need to have your gallbladder taken out, well, that's a job for a general surgeon. We're not going to do that in the DPC office. But I can treat diabetes, you know, in most cases, I can treat diabetes just like any endocrinologist. I can treat asthma just like any pulmonologist. I can treat hypertension just like a cardiologist. I need the cardiologist during those times when I need a stent placed in a patient. And so when a patient has an hour with me, we go through all of those things in that hour and talk about the intertwining of those diagnoses and how they can be improved. And then, you know, we prescribe medications from here when necessary, for all of those problems, and the coordination happens immediately right now. So I'm not going to be prescribing a blood pressure medication that causes problems with the pulmonary medication, which causes problems with the diabetic medications or causes diabetic problems in general. And so that coordination happens sort of by default in DPC, because that's just what we do. We just coordinate everything. And so now the patient has one visit. It was 1 hour. It didn't cost them anything more than their monthly membership. And if they come back in 6 weeks, between now and 6 weeks from now, they're not going to have more doctor's visits. They're going to have a lot of productivity at work, and they're going to have a lot of productivity in their families and in their own lives, and hopefully improving if they're, if they're doing the things that hopefully we're recommending correctly.
Yeah, it's a lot more comprehensive than people think.
Mm-hmm.
I've come to know that I don't need to go see a bunch of specialists. My doctor can handle it because he's got a family medicine background. He also happens to be an emergency medicine. Has a lot of emergency medicine background, including life flight. So, which is where I met him.
Mm-hmm.
And again, I have my CEO hat on. If I've got 5 salespeople, and because of care, they're able to spend more time on the road or more time on the phone or more time in front of clients, each one improves 2%, all things being equal. They increase their sales 2%. That's 10% right there, increase in sales.
Yeah.
So it really is, there's money to be made on top of saving money, on top of preventing problems, and then solving some problems too, probably. Just in terms of, keeping people motivated and keeping my people happy and loving what they do and looking forward to coming into work. So the other thing is that medicine has changed. Medicine has changed now more than ever, and I can imagine from your perspective, during the time you've been practicing medicine and in medical school, when did you start practicing residency?
I started practicing in 2010, so 10 years ago.
10 years ago. So an example would be genome at that point. To map a human genome was about $70,000, $75,000 to sequence a genome.
Yeah.
And it's $250 today. Probably
If
heading
that.
toward,
Yeah.
yeah, if that. And that's just one of many tests that have come along in the meantime. So you have a lot more variability to deal with as a physician. And you don't even have to be a CEO, but if you're an assembly line worker, you know what happens. When you increase variability, that assembly line has to slow down to accommodate the variability, or quality suffers. So slow medicine is really the recipe here, and that's exactly what you do. And I think those are the kinds of things that a CEO or a business owner is probably going to go, wait a minute, that makes sense. There's a lot more to deal with. It's not just genome, it's diet, environment, understanding stress, the research that comes in. So you're dealing with a lot more, and you need more thinking time too. Am I wrong?
No, I mean, you're right. The complexities today require that we spend a lot more time researching and thinking about how we're treating our patients. And, God bless the internet and the speed of access to information today, because I can't imagine, I can't imagine trying to sift through all of this just through books and things. But, I'm sorry to kind of double back on what you said a second ago, but it's interesting because I started thinking about the fact that not only is this slow medicine in that when I'm in the clinic, I can slow down and take time with my patients, and before and after visits, I can take time thinking about, what we talked about or what we're going to talk about. But there's also a lot of speed in what we do, because that same sales force that you were talking about, when they have problems on the road, they have direct access to me. They call me directly on the cell phone while they're on the road, rather than thinking, man, I think I might be having a problem. I'll just ignore that until I get back, and then 5 days later, they end up being hospitalized for something, rather than being able to talk through it as they talk with their doctor. So there's a speed component to what we do as well that's very, very beneficial to our patients.
Excellent point. Yeah, that access. I love it. I love the access. And there are times when I remember I had a pain in my foot, and I texted, WhatsApp is very popular. I sent a WhatsApp to my doctor, and He said, okay, he asked me a few questions, and he said, okay, what you have is plantar fasciitis. And what I want you to do is get these pills, 2 a day for 5 days. If you feel anything like this, let me know. Otherwise, you're going to have to do some stretching, go on Google, look up stretching exercises and do those. And he was right. No office visit. That was 10 minutes. It was real simple. I love it.
Cost you almost nothing extra.
No, it's just, forgive me, but it's a duh moment.
Yeah.
Once you've experienced it, you will never go back. So if I'm the CEO, how do I know my people are getting great care? There's a lot of variability there. I mean, it's not consistent. And I'm looking for consistently good performance. Excellence is what I'm looking for. I was just thinking, you have people that are going to clinics, just clinics, whether they're seeing a doctor or a nurse practitioner or whatever, but they're not getting the continuity of care. They're not getting the attributes that you bring to the table. And if I'm listening to you, I'm thinking, I want all my employees to have that. And that's the point of the variability between the providers, whether it's the clinic, the urgent care clinic, they don't see anyone until, they need to go to the emergency room. That's what I was thinking. So,
well, and that's what I was getting at, is to say that the continuity of care, whether it's a provider who is the best provider in the country or a provider who is not the best provider in the country, the continuity of care makes that it's such a huge deal that even someone who is marginal at what they do is providing better care just because they're familiar with the patients and the patients are familiar with them and they know what to expect both ways. And so if someone's options are, I just need to go to whatever urgent care happens to be open right now, and I'm going to get whoever happens to be working in that urgent care right now, or ER or clinic or whatever, if their option is to have a direct primary care physician or even a direct primary care nurse practitioner who hopefully is working directly with a physician and has some direct access to bounce ideas off of the physician they're collaborating with, then at least they get that continuity of care and they get the same person over and over and over again who knows them very well and they know very well. And so, I mean, there is always going to be variability in the care that people receive. But when the variability is only that this is the person that I have access to, at least if I have access to that person all the time, then it's going to be way better than someone who doesn't know them at all.
Right. It's all a part of getting primary care right, which is, I think, is critical. And especially in this year, you did mention a little bit about the specialist and when you recommend a specialist. There's catastrophic care too. If I have an employee that's going to, gets in an accident, God forbid, goes to the hospital, you're part of that scenario too, right?
Mm-hmm. Absolutely. What is your question there? I guess that's there's a lot to unpack in what you said.
You're going to be part of that scenario, meaning the employees in the hospital, and yes, they're being treated by a hospitalist, but you're their doctor. You can provide a lot of added support, if you will, including telling those hospitalists, look, my patient doesn't like news presented this way.
Yeah.
The human factor, the human touch, bringing the humanity. And I bring it up because I know there are hospitals that have Sherpas, medical Sherpas. And I thought, wait a minute, that's what my doctor does for me. I mean, if I go to the hospital, Javier's getting a phone call and he's going to go to the hospital and he may not be able to direct things, but he's going to say, okay, this is what is going on. And he's someone that I trust. I have a relationship with him. I don't know who these doctors are. They may be great people. Great, fine. But if I'm your patient, I'm thrilled that you're standing at my bedside going, hi, here's what's going to happen.
That's exactly right. So I will say that some direct primary care doctors actually do admit their patients to the hospitals themselves and round on their patients and do that. It's kind of a rare thing now, I think, in direct primary care. I'm sure some of the comments on this, once this is uploaded, will, whatever, there'll be some of my buddies attacking me on that statement. But anyway, I think it's a rare thing now that direct primary care doctors are actually admitting to the hospital, which is true for all primary care physicians now. It's become a more rare thing. And so hospitalists are doing most of the care in the hospitals. The difference in direct primary care is that we do social rounds, at least in my practice. All of my patients who get admitted to the hospital, the hospitalists are the guys, actually putting in all the orders and kind of making some of the decisions or all the decisions. But I do social rounds on those patients at least once a day, usually twice a day, where I can go in and I can talk to the hospitalists because I maintain relationships with those guys. And we, go over the plan of care so that I can then walk into the room and reassure the patient and say, hey, listen, I think what they're doing is great. And trying to give a layman's explanation as to what it was. And hey, Dr. Smith came in your room this morning and explained what was going on. Tell me what you heard him say. And then they'll tell me, and it'll be 60% correct or 80% correct or 20% correct, whatever it is. And so then I get to, sit and unpack it with them. And again, giving them that peace of mind and knowing that they're actually being taken care of in the right way. And hopefully having someone in the room that they trust. And, ultimately it's kind of like having a doctor in the family. Someone who has a family member who's a physician, they get that same care. The difference is my patients all get exactly the same thing.
Yeah. Yeah. So last CEO type question. And you have a small business that you mentioned that's signing up this week.
And I have several that are already enrolled. So you have experience and you can help me integrate Elite DPC into my benefit plan for my employees. Mm-hmm.
I'm not flying blind.
Mm-hmm.
Okay. That's an important point.
Absolutely. In fact, so that company is small enough that they're not required to provide, a fully funded, prepaid health insurance package, or health. I don't even know what to call it because it's not insurance. It's something else. It's a big prepaid health plan.
Mm-hmm.
They're not required to provide that. And so we can show them how they can give, essentially total wraparound coverage, without having, to pay for everything up front. And so they get, catastrophic plan and then a DPC membership with it. Another option is larger companies that have more than 50 employees who are obligated to provide health insurance for their employees and HCA compliant type insurances. It used to be that very, very large companies were the only ones that were able to afford self-funding of insurance. And so they all have fully funded plans, which are the expensive plans that we all know about now. And when you couple a self-funded plan or what they call also level funded plans, which are somewhere in between. So there's, fully funded plan where you pay a premium to the insurance company, guarantees payment for everything that might happen with your employees. A self-funded plan is where, you accept most of that risk yourself as the company, but have a stopgap with an insurance company. Mm-hmm. Level funded plan is where you sort of pick a level in between those two, of risk. And that's, something for really small companies to look at, especially with younger, healthier employees. But with either of those level funded plans or self-funded plans, when you couple those with a direct primary care membership and that doctor is involved enough that he develops relationships with your employees quickly and they, can develop some level of trust to know that that is the person that they want to call when they have problems, then it mitigates a lot of the nickel and dime sort of risk that can go along with those plans. Mm-hmm. And those plans can be a lot cheaper up front, which is typically the truth. But at the end of the year, there's a risk sharing portion of those, and the insurance companies or brokers can explain those to CEOs. But that, if they end up having really low claims throughout the year because the DPC doctor has been taking care of everything, then they can also get a lot of that money back at the end of the year, which becomes a savings. And then because of the low claims, the premiums go down year over year, which is the opposite of what they typically do with fully funded plans.
Yeah, I'd say so.
Yeah, and we can absolutely walk people through that. We have brokers that we work with directly for both individual plans and group plans. We have big brokers that are working with, large companies and fully, full benefits packages and things. And they're all kind of slowly but surely coming on board and starting to understand how we can do this the right way and help companies and help, employees experience a better way to do healthcare.
Sure.